These are all WHO priorities. Why should we invent our own? These should become part of the Ayurvedic agenda for public health. Also, India's own agenda for public health, safe water, safe motherhood. These all should be part of the agenda for Ayurveda and addressed in a systematic way. And I would say, as a public health researcher myself, these should not only be addressed as a public health agenda, they should be evaluated through public health research to look at the public health outcomes of these interventions. Otherwise, it's just goodwill and talk. Without evidence, there is no proof and there is no systemic policy change. I'd like to give you an example of a public health intervention here in Bangalore, Karnataka, and in many neighboring states, done by the Institute for Ayurveda and Integrative Medicine here in Bangalore, FRLHT, on whose governing council I'm privileged to sit. They simply developed a medicinal plant program for families. Very simple program, 6,000 villages, 150,000 families, and this was a pilot study. I'm always impressed by the scale that constitutes a pilot study in India. 150,000 units in any other part of the world would be considered a large-scale trial, but this was just a pilot. And what they did was they selected about 20 medicinal plants, but region-specific. So the plants of the northeast were different to the plants used in the Western Ghat region, and different to the plants used in the northwest, and so on. But 20 or so plants known locally to be effective against common ailments: cough, cold, fever, cuts, headaches, minor gynecological problems, and so on, discharge. These are the things that families go to the local dispensary or the local market to buy a small number of medicines to manage. When we looked into the research, the health economic research for India, we found that among the rural poor of India, the third highest area of family expenditure is on medicines. Food, shelter, medicines. Not food, shelter, school books, school fees, school uniforms, transportation. Food, shelter, medicine. The third highest area of expenditure for the rural poor. If you can reduce expenditure on medicines, you are impacting poverty. That is a public health intervention. This is one of the 6,000 resource workers, all women appointed through women's groups, who were trained in developing these home herbal gardens, who in turn trained women in the families to grow these plants, to prepare them, to use them for the selected conditions. You can see just a few plants growing by the wall of this little house. Nothing very glamorous in terms of garden landscaping, but a collection of important home medicines. Here's what came out of it. First thing is that the study found that the program was adopted by the poorest of the poor. It benefited mainly women and children in poor communities for common ailments. The families who didn't adopt the home herbal garden program were found to have an expenditure on family medicines that was 5 times higher than the families who had the home herbal gardens. That was a reduction of 80% in the money that these home herbal garden families were spending on medicines every week, every month. 80% reduction. That is 80% of that money on medicines now available for kids' education, whatever else the family wants. The women themselves, who were the resource workers, were making 500 rupees a month in addition to their other income. so it was income generation for rural women. And that raises a question. I learned the other day in Delhi, talking with senior directors of a leading hospital group, that there's a forecast that India needs 75,000 new hospital beds every year. I was shocked. 75,000 new beds a year. I said, based on what? They said, well, based on current morbidity figures. I said, so the presumption is that India is not going to prevent anything. The presumption is that India doesn't know how to reverse any health problems. The presumption is that Indians are going to get sicker and sicker and need more and more hospital beds. Well, I would say to the World Ayurveda Congress, there's your challenge. If a simple study like this can reduce health expenditures and improve health status of the rural poor to this extent, do they really need 75,000 new beds a year? Or is that a business vote that says we want to build more hospitals, whereas the health sector should be saying we want to create a disease-free society. We should not need those beds. Here's a simple solution. That is a public health strategy, ladies and gentlemen. We've done more on this in our book on public health, policy and public health perspectives of traditional medicine. There is a chapter written by my colleagues from IAM on the Home Herbal Garden project, if anyone's interested in looking at this further, published by Imperial College Press in 2007. I want to move also to Ayurveda and wellness. I don't believe that Ayurveda has grasped the scope of the wellness movement worldwide. Stanford Research Institute in America did a study in 2008 using data from 2007, and they valued the global wellness industry at over $1 trillion in just that 1 year. You've all heard about the problems in Europe with the banks failing, following America, with Ireland having to be bailed out, Greece having to be bailed out. Do you know how big that bailout fund is? $1 trillion. People are spending more than $1 trillion on wellness at the same time as banks are being bailed out for a little less than that. That's how big and how important that is to the world's population. The spa component of that was assessed at $254 billion in value in 2007. The global golfing industry in the same year was $80 billion. The motion picture industry was $27 billion. You can see how important wellness activities are to the people of the world. I think it's important for Ayurveda to understand this, not to compromise or become cute in how Ayurveda is presented, but to recognize this trend and recognize that of all the traditional medical systems in the world, and I say that in consideration of Chinese medicine, which I know well, and the other Asian medical systems, Ayurveda is the most comprehensive in addressing issues of lifestyle and wellness. If Ayurveda doesn't catch this wave, it's missing the point of what's happening in the 21st century. Swasthya is health in Ayurveda. Swasthya, established in the self, is a wellness conceptualization of health. Bala, strength, vitality, is a wellness conceptualization of health. And I think it's important for Ayurveda to focus in on this wellness track and develop a language and a body of evidence and a range of programs to address this as well. One important part of this is Ayurvedic nutrition. We don't know enough about this. We don't hear enough about this. How many of you have heard of the Mediterranean diet? Yes? Anybody at the back, you heard of the Mediterranean diet? One lady has. Well done. I think a lot more have. The Mediterranean, front row has too. The Mediterranean diet has been found to reduce cardiovascular risk and to reduce the risk of cancer. What is it? It's steamed foods, it's salads, it's olive oil, and so on. Now, I ask you, you go into a rural village in India and say to people, well, you should be having steamed skinless chicken and fresh lettuce and lots of olive oil. Some people are laughing, and that's what the villagers would do if you went in and told them that. Why isn't there research on Ayurvedic nutrition and heart disease prevention and cancer prevention and diabetes prevention and reversal? This, I would say, is an important part of the wellness, lifestyle, and indeed public health contribution that is waiting to be done in Ayurveda. I mentioned spas. The word spa is from the acronym Salus per Aquam, health through water. Well, Ayurveda is really much more about oil. Spo doesn't sound quite as good as spa, sanus per oleum. But if you see the bottom line there on the screen, you see this quote from Charaka, who talks about the value of oil. The body of one who uses oil massage regularly does not become affected much, even if subjected to accidental injuries or strenuous work. By using oil massage daily, a person is endowed with pleasant touch, trim body parts, and becomes strong, charming, and least affected by old age. Well, isn't that a very nice bit of insight? We should all be doing daily abhyangas, and we should be telling the world about the value of this as part of wellness. Where is the evidence? We need research on this as well. Again, for more information, I'm sorry if it sounds like I'm telling about all my own books. I'm not selling them though, so this is not a marketing exercise, but just for your information, we produced a book on understanding the global spa industry, and there's a section there on traditionally themed spas if anyone's interested in learning more. And then there's education. As part of this globalization agenda, we need to focus on courses for doctors and health professionals, and I was very happy, Madam Jalaja, to learn from Dr. Sharma's talk the other day that there's now standardized curriculum that WHO has lent its stamp to for Ayurvedic courses for doctors and Ayurvedic students. Ayurveda also needs to be taught in medical schools. I've run courses in Ayurveda, introductory courses in Ayurveda at the Oxford Medical School for Oxford University students, and one day I had a visit from the Health Minister of Sri Lanka. Sri Lanka has a department, a ministry of Ayurveda, not just a department. And he saw this book on Ayurveda on my desk and he said, "What's this?" And that's the Sri Lankans over there. And he said, "What is this for?" I said, "This is a text I use when I do an introductory course on Ayurveda for our medical students." He said, "You teach Ayurveda to the Oxford medical students?" I said, "Just an introductory course." He said, "We have a ministry of Ayurveda in Sri Lanka, and I can't get our doctors to have even an introductory lecture on Ayurveda."